Hello, welcome to the pharmacy. It's kind of a small area, but we have it organized pretty well. To start, in the very top shelf, we have some health supplies like shampoo, bars of soap, toothbrush, toothpaste, condoms, and hand sanitizer. So if you ever get requests for those items, you can come up here and grab them. Sometimes patients will ask for just one toothbrush, and it's just a young child, and I just go up here and I grab it and I hand out one toothbrush to that people. Do you do that? I don't know. Yeah, that's fine. Okay, that's okay by Diane. Next, we have our area right here that's of medications that are in pills. This area is organized alphabetically, this shelf and this shelf. So say I need a medication like in the G box. I'm going to pull out the G box, I look on the side, and I need glipizide. Yeah, we have glipizide. So I know that in this box contains glipizide, and I look for it and I grab it. So the pills are here and here. That's kind of the first place I go to when I get a request for medication. So I start there, and if it's not there, it's got to be somewhere else. We have an area right here which are our most common medications, so things like Allertec or Advil or acetaminophen that we use frequently, we keep those right here. Underneath is our section for vitamins. We often give out vitamins to most patients, so it's handy to have it in easy access. Moving on, we don't really touch this top shelf. This shelf is all liquids, and same with down here. The liquids are organized alphabetically, but sometimes they get a little unorganized, so just keep looking for a little bit before you ask. In this section right here is going to be antibiotics. You might not be familiar with the names of antibiotics, so we keep them all in one safe space. And if you get a question, you're like, maybe it's an antibiotic, but I'm not sure. You can come on over here to the list of antibiotics, and we have them listed all out for you. Under here, we have a box of blood pressure medications. So say you get asked for lisinopril. You go to the L box, you can't find it. Maybe it's a blood pressure medication. So you go into the blood pressure box and you can find lisinopril there. Next to the blood pressure box are going to be these two containers. Often patients come in with diarrhea, and we also often go to electrolyte replacement and emergency and things like that. And so we have these right here. This is parenteral, and here you have Suero, which is electrolytes. When we hand out liquid medications, we often don't do them in giving them the whole bottle, we just give them as much as they need. So in this back far corner are supplies for small tubes like this, along with their caps. When you give medication like this, it's important to give a measuring device. So we have this box that contains cups like this, and it says 1 tablespoon or 15 milliliters. And I think that's about it for our pharmacy. Just kidding, we have one more corner of the pharmacy that I forgot. In this area, we have all of our oral drops at top, some asthma medication, inhalers, and down here are all creams. And they have labels on them too, so you can easily find them. Hey there, we just finished the next patient. Here you go.
Okay. So now that Deanna has gotten the patient card stating the patient's name and the ID number, she's going to go ahead and look the patient up on the EMR. When she finds the patient's details on the very first page, she's going to then fill out the clipboard using the information. Here on the clipboard, she's going to put the patient's ID number, whether it's an adult or a child, whether it's male or female, and where they live. All this information can be found under the Patient Details tab. Next, she's going to click the Consultations tab. She will then scroll down and find the patient's note from today. There, she'll be able to read the doctor's note after the patient visit and look under the tab that says ID, which is the patient's diagnosis. There, she'll fill out the last column of the clipboard. Next, she's done with the clipboard. and is going to read the treatment plan on the patient's note. Deanna prefers to write the patient instructions on the paper that will be given to the patient with the medication before she pulls out the medication. Here on the paper, she writes the patient's name, the name of the medication, and is then going to explain to the patient exactly how to take it. If you notice, the doctor has written out pretty clear instructions. Occasionally, the doctor will write out the instructions in abbreviations because that's medical knowledge and it's shorthand. If you're confused, you can take a look at our abbreviations page in the window to find the abbreviation to understand what the doctor wants you to write. If you have any questions, always feel free to stop and ask someone for help. Remember, this paper is going home with the patient, and if the patient gets confused, that's how the patient is going to know how to take their medications. Please try and write clearly and write all words out. Next, she's going to collect the medications. We have a small container of baggies, which she will lay out. She'll go ahead and grab the marker, write the patient's name on the baggie, and the name of the medication she's going to put in that specific bag. Next, she'll find the medication. Most of our commonly used medications are going to be directly to your left. If it's not a commonly used medication or is not found in that container, our other medications are alphabetically organized. Some volunteers like to put the pills within the cap and count out the pills within the cap. If the pills are small enough, this may work well for you. The key is to try to minimize the amount of touching of the patient's medication. No one wants to take pills that have been touched by a bunch of hands before they get there. Another way is to put the pills directly in the baggie and count them out. If you realize you have more than what you need within the baggie, you can always just take them out and put them back in the bottle. But try your best to do it without touching the pills. Next, we're going to go ahead and close the baggie. We fold twice to prevent any pills from falling out and place a piece of tape. Now that medication is ready to be given to the patient. Once she's prepared all 3 baggies of medication, she'll go ahead and take those medications to the patient and explain to the patient what's written on the paper, explaining to her which baggie is which medication and how to take those medications.
María,
¿Esta es mi medicina?
sí, tengo tu medicina. Esto es para ti. ¿Sí?
Bueno,
Tengo tu loratadina.
esto para mí.
Sí, tus alergias. Necesito una pastilla cada día por 14 días.
¿En la mañana o en la tarde?
No es importante. ¿Ok? Estos son tus vitaminas. Una tableta cada día.
Bueno,
¿Ok? Y esto es tu Advil para dolor. 2 pastillas cada 8 horas.
por 7 días.
Sí,
Perfecto. Muchas gracias.
de nada.
Sometimes we get patients that are pediatric patients, so they can't take pills. We have a lot of liquids in our pharmacy, but it gets a little complicated when we have to provide the medication to the patient. So, our example today is this patient who needed Benadryl liquid, 10 milliliters every night for 5 nights. Luckily, the doctor did all the calculations for us, so we already know that all we have to give is 10 10 milliliters for 5 nights, so 5 times 10 is 50. Here in the clinic, we have these measuring beakers. We also have little measuring cups. And we have these tubes with caps. First, we get a measuring beaker. We find the correct medication in liquid form. And we pour out the correct amount of liquid medication that the patient's going to need total. When we know we have 50 milliliters, we go ahead and pour it into the tube. The tube is what's going to go home with the patient. We then take our permanent marker, we write the patient's name, and the medication we're giving her. Try your best to use a different colored marker than the liquid medication. Then, we'll go ahead and find a good plastic measuring cup to give to the patient. She needs to take 10 milliliters. This doesn't have a 10 milliliter sign, so I'll find a different one. This one has a 10 milliliter marker. To enhance it for the patient, I'll go ahead and run my marker over it, just so they can see that that's the correct level that they need to pour. I'll go ahead and give that away to the patient with the medication. And I'll also write a little paper with the patient's name and the instructions. Sometimes when our pediatric patients need liquid medications, the doctor won't have done the calculations for us to know exactly how much medication to give the patient. This requires a little bit of math on our part, but hopefully we can explain it to make it as simple as possible. With each bottle of medication, there's a certain concentration. So this bottle of acetaminophen, which is Tylenol, has a concentration of 120 milligrams of Tylenol for every 5 milliliters of syrup. Also on the bottle, it explains that there should be a certain dosage for the patient's body weight. This bottle states that we should give 10 to 15 milligrams per kilogram per dose. Knowing this, we can go ahead and write this down on our paper and start the math. As I said earlier, the concentration of the Tylenol is 120 milligrams for 5 milliliters. This was on the bottle. The dosage, as recommended by the bottle, was 10 to 15 milligrams for every kilogram of the patient's body weight. Okay, let's go ahead and decide that our imaginary patient weighs 12 kilograms. And let's also determine that our imaginary patient is going to get 10 milligrams per kilogram of body weight. So what we have to do is figure out how many milligrams we should give the patient. The patient's 12 kilograms, and we're going to multiply it by 10 milligrams for every kilogram of weight. That means the patient should get 120 milligrams total of Tylenol with every dose. Now we want to figure out exactly how many milliliters we have to give. As you can see, this is going to be a very simple mathematical equation, but we want to just make it simple so that way we understand the concept. We know the concentration is 120 milligrams of Tylenol for every 5 milliliters. We're going to set this equal to the desired dose, which is 120 milligrams, over X, because we're not sure exactly how many milliliters that would be. We do a cross multiplication where we get 120 times 5 is equal to 120 times X. We divide by 120 to get X by itself, so 120 times 5 divided by 120, and now we're having X by itself. We realize that the 120 cancels out, meaning 5 is equal to X. So that means for this patient, we should be giving 5 milliliters to make sure we get the adequate amount of Tylenol dosage. So we then will find out from the doctor how many times a day they want to give this patient this Tylenol and how many days they want to do it. So knowing this, say we find out from the doctor we need to give the Tylenol 3 times a day. So we would take 5 milliliters times 3, and that means we want to give 15 milliliters in 1 day. Then we want to know how many days. Say the doctor decides we want to give the Tylenol for 3 days. it's 15 times 3. So 15 times 3 is 45. So I would take the Tylenol, pour out 45 milliliters into my beaker, go ahead and put it in my tube, and give it to the patient with the instructions that they're going to take 5 milliliters of syrup 3 times a day.